Good afternoon and welcome to Stratasan's webinar, a comprehensive approach to service line growth. We appreciate all of you all joining us today. My name is Drake Jarman. I'm the VP of Sales, and I'm joined with Sean Conway.
I am the product specialist for our physician pathway platform.
And we're excited to have you guys with us. For those of you guys who are not familiar with Stratasan, we do currently work with 700 hospitals in 40 states. We started the company 6 years ago with an effort to make data a lot easier for healthcare and for strategic growth. And that is why we are pleased to be with you today and to talk to you guys about service line planning. With these 700 hospitals that we work with in the 40 states that we work in, we currently have an analytics platform. We have a strategic resource group, which we call our Spark services. And finally, we have a physician pathway platform that helps hospitals with inbound and outbound referral volume. Today, we will show you guys how to blend those three services and software to help you guys with strategic service line growth. So let's jump straight into it, and let's talk about Winter Haven Hospital in Winter Haven, Florida. It is a 527-bed hospital. Your nuts and bolts hospital that services service lines include pulmonary, cardiology, OB, gastro, general medicine, and orthopedics, along with many others. It is located right here in the central Florida region. It is somewhat of a suburban hospital outside of Lakeland, Florida. It is very similar to many of the other hospitals that we serve throughout the country. The approach that this hospital was looking for and what I'm going to prove to you guys today is how to improve orthopedics. In this case, a strategic planning department, really a strategic growth department, was approached by their executive suite saying, hey, we need to increase orthopedics. We're going to show you guys how we got to that conclusion of orthopedics and where to target patients and where to target physicians to align all three of those areas for strategic growth. So the first thing I would like to cover will be the tools in the toolkit. As you guys may have seen in the emails leading up to this, we are calling this a product line toolkit. And we want to make it so this webinar can leave you guys with some valuable insights on ways to approach service line planning. That could be with the help of Stratasan or with the help of yourself or with some of our competitors. So the first thing we are going to look at would be the data sources. For this facility based in Florida, we are using ACA data. We're using their internal data, and we're also using ESRI for demographic, psychographic data as well. It is important to note that this is a hypothetical use case. In this case, we are not using actual patient data, so please do not fear that we are using somebody else's HIPAA protected data. The second thing you guys will need to be successful in producing a report like this are going to be some data tools. Obviously, Stratasan has a strategic analytics platform that we use in this use case, but you could have also come to the same conclusions using SPSS, Microsoft Access, a SQL Server, the advisory board, Truven, SG2, IntelliMed, or a few others. So there are plenty of data tools out there that are at the ready to help you guys make sense of all of the big data in the market. Next thing we used were mapping tools. In our case, as many of you all know, we are heavy users of ArcGIS, which is an Esri platform. We geocode a lot of patient data on that, as well as produce a lot of maps on that also. Other platforms that you could use in mapping would also be Maptitude, MapInfo Professional, as well as Tableau. Those are all three health grade level, very good mapping platforms, though we are particular and partial to ArcGIS. The other items that we used were simple Microsoft Excel and Microsoft PowerPoint. And that's more for the data visualization to help you guys out to create simple or easy to read and understand and visualize reports for your executive team. Obviously, for this report today, these are the services that we used to produce what we're going to talk about today. Now, as we move further, I want to talk about strategic growth as essentially a rocket ship or an airplane. In the cockpit, you guys have strategic planning. There are a lot of strategic planners on this call today, and it is your job to obviously set the course and to define where we are going. Moreover, it is also your responsibility to monitor the plan to make sure that we are flying in the right direction. So you guys are up in the cockpit, really, charting the course. You also have marketing. Marketing is one wing of strategic growth. The marketing team is all focused on execution. They take your decisions and they take your directives to focus the right message to the right people. This could be through digital, mail, screenings, you name it. Whatever traditional marketing tactics you guys use, that would be what the marketing team does, and that is one wing of the space shuttle. The other wing is going to be physician relations. And so that team is obviously designed to help build relationships, to strengthen referral volumes, and to really sell the idea of your hospital based on cost, quality, and convenience. The whole goal of this webinar today is to show you how we can align these three departments for all things strategic growth. And when you do that, you are able to take off into a beautiful future for that particular product line. So with that, I'm going to jump into our first report. All right, so Winter Haven Hospital. The first thing we wanted to do was look at what was happening in the orthopedics product line. Once again, the data that we used here was ACA, and we have some Esri data as well as the internal patient data of the hospital. Once again, this is masked, fictitious data. We are not sharing anybody's actual patient data. So as we look at this service area, we have the hospital right here in the blue, and they are Winter Haven Hospital. They will be blue throughout the entire presentation, both on our graphs and on all of our maps. The primary service area for this facility is the few zip codes directly surrounding. This is a 50-75 service area, meaning 50% of the inpatient origin comes from these 4 or 5 zip codes here, and the remaining 75 from these green zip codes. Together, they make what we refer to as the CSA, or combined service area. Now, why did we pick orthopedics for this hospital? Well, other than the C-suite came in and said we've got to juice up orthopedics, there were some troubling trend lines that we noticed within orthopedics. These are the overall discharges by product lines for Winter Haven in their CSA. So this is not just with Winter Haven, but this is the entire service area going to all hospitals. And you can see pulmonary cardiology, those are big. But what we can see is a negative trend here where we jumped up in orthopedics in 2014, and then we had a dramatic decrease in 2015. And so now we're going to want to understand what happened there. Why do we have such a dramatic decrease? So the first part of this is to understand what is happening in the market. As you guys can see, there are total 2,327 cases in orthopedics for this market. Winter Haven in 2015 had 510 of those cases for a market share of 22%. The goal that we're going to set for this hospital is to increase by 5%. So a 5% market increase is going to be market share increase is going to get us up to about 27%. That incremental volume incremental volume needed to add 5% is going to be 116 cases. So as a strategic planner, we need to now go find those 116 cases. Now, from looking at a marketing spend and determining how much fuel we have in the tank, we can see that our potential charges for that would be $6.8 million, and our potential revenue in this case is going to be about $2.4 million. So there's a lot of opportunity here that we are currently missing, and that of these, it is really one of the biggest opportunities for us to focus on. Other service lines that this hospital has a great opportunity with also would be gastro, as well as some others. The first thing we're going to do with this data is actually look at the hospital's internal data and look at their internal orthopedic discharges by block group. And this is a perfect opportunity for me to issue our first poll of the day. And that is going to be, do you use your internal data to help you guys draft or help you guys focus on where you should be growing and where your strategic growth should occur? So in this case, and on this slide that you should be seeing, you will actually see block group patient origin. And so we have a poll in progress. 33% have voted. So we'll let you guys vote. We're almost halfway. For the about 15% remaining, I'm going to go ahead and assume you're already watching Netflix. It's okay, I get it. All right, we are just over the 76%, 81%, and we are going to close this poll in 3, 2, 1. All right, the results show that 12% of our callers today are mapping data down to the block group or rooftop level, which is what you see on the screen today. That's fantastic. As you guys know, healthcare data from the state is at a zip code level, and Medicare data, if you're in a state like Alabama or Arkansas, is at a county level. And so for you guys to be able to get granular and really focus on block group level diagnoses or really figure out what's happening in your market, you need to be able to map that data lower. 35% are using their internal data to really look at where their patients are coming from. They say yes, but not as well as I'd like to. 41% just say yes, they are using this data. And 6% say no. And then another 6% say, what is internal data? So internal data would obviously be your internal discharge data, which you should be able to get on a monthly basis. The map that you're seeing here is a map that shows down to the block group level where your patients are coming from. We could have done this at a rooftop level, but that gets pretty wonky. And so we found the best use of this type of data is to look at the block group level. As many of you guys know, block groups are part of the census. They're technically called a census block group. And they are redrawn every 10 years based off of more socioeconomic trends and population density. Their larger counterpart, just census tracts, are based primarily off of population density. What's nice about these is they change every 10 years with the census, and unlike zip codes, they're focused more on the types of people rather than mail routes. So with this hospital, you can see we have some nice volume, internal volume that we can see coming from this area. This zip code has some lighter area in this block group, and then as you can see throughout, we've got some lighter and no volume from some block groups as well. We're going to pull out a little bit and start to look at orthopedics discharges, total market orthopedics discharges. And so this is going to be primarily ACA data, which is available at the zip code level. With this, what you're going to be able to see is, where are the patients overall? And we have somewhat of a gradient level here on the right that is going to show you guys where are the more patients in the CSA. Which the good news is this hospital is planted right in the middle of the heavier discharge areas. Next, we're going to look at a zip code level how we're doing. And you can see, once again, we do pretty well around our hospital. Not so well as we zoom out. We're not getting anything from Greater Lakeland, which is not a surprise, as patients typically will not migrate out to a suburban area. And then next, we're really going to want to see where our competitors are pulling their patients. And so all of this is to help you guys understand where are we doing well, where are our competitors doing well, where are we losing patients. And so we can see that up here, Haines City, Heart of Florida Regional Medical Center is going to be a hospital that is pulling a lot of patients from us, and we will focus on that hospital here in a little bit. Obviously, we're also going to want to see market share. You guys are going to want to go just beyond, not only is how our hospital is doing and where are we losing patients, but to whom are we losing patients. So as you can see, Heart of Florida is going to be green, and they are taking the vast majority of these patients up here to the north. We can see that Lake Wales is red, and they're taking patients here to the south. Lakeland itself is pulling from this zip code, which is interesting because they're jumping our hospital to get back to Lakeland, and all others are coming from elsewhere as well. Next thing we also want to understand is market dominance. Who's winning each zip code by how much? And so what this really shows is where are our opportunities. As we look up here to the north, Heart of Florida is near 60% in zip code 33844. That's a challenge. That's going to be a challenge for us to pull market share from this zip code as opposed to 33850, where they only have 33%, and it's much more of a split market in terms of dominance. As we go through, we're also going to be looking at, overall market share, our market share, and then we also want to show this in table format as well. That is simply because some people are visual learners, some people want to look at tables. But really and truly, what we're seeing here is our orthopedics and market share in the combined service area. What's happening? In 13, we're at 428, and now we're at 338. That's that 5% in the primary. We've lost 5% market share. And down here, we're the number 3 player in our combined service area, our secondary service area. And in this case, we've lost 2% market share, which amounts to about, 19 or 21 cases. So both of these are pretty big dips, and we need to start creating strategies to help stem those dips. Where is that volume going? We can see Heart of Florida right here has a dramatic increase over 3 years in our primary service area. Bear in mind that our primary service area is likely their secondary service area, so they've gone up 6%. That's going to need to be something that we need to evaluate and really look at what's happening there. Other large increases are going to be in our secondary service area, where you can see Lakeland Regional Medical Center has gone up 5% in 2 years from that secondary service area. And that's primarily from that area to our south and east, which is where those patients are actually skipping our hospital and going into Lakeland. Finally, we will also look at it from a combined. This is where you are going to see the roughly 116 cases that we need to find to get back to that 5% market share that we've lost. One thing before we leave, I do want to note that outmigration market share has also increased. And so this market is becoming exceedingly competitive. And so not only are we losing patients to our neighboring hospitals, we're also losing patients beyond the market. And so that's something we're also going to want to take a look at. As we move forward, we want to look at the whole market's inpatient orthopedic discharges. Once again, this is a product line deep dive to really understand what's happening in this market. And so what you can see here is Heart of Florida, you're going to hear them quite frequently, and Lakeland Regional are both on the upswing, and we are on the downswing. Nobody else, Bartow has had a significant drop. I'd be curious to know if Bartow's drop is at the expense partly of us, but also going towards helping Lakeland and Heart of Florida. And those are some of the questions we'll start to approach towards the end. As we move forward, we're going to start looking at the case difference in orthopedics discharges. And so this is going to help us understand internally. I showed you big picture that we are losing patients in our primary and we're losing patients in our secondary. But let's look at the 2-year difference at a zip code level. Once again, 33881, our home zip code, is our biggest, just about our biggest loser. Our biggest loser is just south to us. So the vast majority of our patient losses are coming from, and this is a 2-year trend, from these 2 zip codes. So we have some real problems here in our backyard that we need to really understand. And we'll look at, obviously, payer mix. And payer mix is going to come in very important as we switch to marketing. Right now, we're still in the cockpit as we're trying to understand where are the problems. We know big picture that we're having issues. This part is in the strategic planning world where we're trying to understand, where are these patients where are we losing these patients from, but also where's the payer mix? Obviously this is in Florida, and so you can see that there is a healthy amount of Medicare, which is the dark blue. You can also see that commercial is our second largest payer, which is great. And then we also have some Medicaid, which is coming in our southwest part of our service area, a little bit stronger. We'll touch on Medicaid here in a little bit. And you can see we also have some charity and self-pay as well. And then we want to look at the payer mix and volume. And so this is just overall in the CSA, our payer mix and volume. This is not just our hospital, but it's pretty flat. We've had a little bit of an uptick in commercial. We've had a little bit of uptick in Medicare, but we've had a decrease overall in Medicaid. Once again, this isn't just our facility. This is laying out what's happening in the market. However, when you look at our own data and look at our market share by payer type, you're going to be able to see that we've had a decrease in commercial. We've had a decrease in Medicare. But even though the market is decreasing in Medicaid, we've had a significant increase in Medicaid. And so that's going to be a real challenge, obviously, for reimbursement, and Medicaid in Florida is not the best. And so that is definitely going to hurt our contribution margin. Self-pay and other are obviously on the decrease, as is most of the case in most states. We're going to get a little bit deeper now to understand, and this is going to be breaking orthopedics down into sub-product lines. This is when we get a little bit more granular to understand what cases are we losing. And so at this point, we're looking at overall cases at a sub-product line level. So you can see that obviously with the silver tsunami that is hitting Florida with the retirees, there's some big retiree communities outside of Lakeland. They're in Central Florida. Joint placement and revision is the #1 orthopedics product line, which should not be a big surprise for most folks, followed by fracture, other orthopedics. I will focus on spine and medical back too, because that's not insignificant and it also reimburses pretty well. However, if you look at, and outmigration for this, but if you look at our volume, you can see how we're doing over the past 3 years with each of these. And so in this case, major joint, we are increasing in market discharges. Let's see, yep. But we are decreasing in market share. So this is a situation where, over the past 2 years, it's gone up, and that's great. So if we were only looking at our internal data, we'd say, man, this is great. We're up 140 cases over 2 years, 3 years. However, if you look at our market share, there's a major dip in the joint replacement. We also have some problems, as I mentioned earlier, in the decrease in spinal fusion and medical back problems, where you can see our hospital has dropped from 58% to 30%. In this situation, we may want to look at our physician staffing needs to understand whether or not we have the right doctors in place with the hospital. A dramatic drop like this tells me that we probably lost a doctor between 13 and 15. And we'll look at some of the other granular details, but that's the first step to what we were trying to accomplish there, is really understanding what's happening. Where are we losing volume? And what is that volume? And now it's time to say, okay, we need to start to fix this. And so the next piece that we do as part of our product line toolkit is what we call micro-target marketing. So, oops, let's pull up. That was all right. So micro-target marketing is a product and tool that we work with our clients on. And the goal of this is to take the previous report, which tells us what's happening in the market, and to take that data and to help you guys focus on where to target your message and where to target your outreach. As many of you guys know, not all volume is good volume. And so when we invest resources, whether it be the left wing of marketing or the right wing of physician relations, we want to make sure that we are sending the right resources to the right patients to achieve the right market share that we want. So the goal of this second report, titled Micro-Target Marketing, is to really help you guys focus on block groups and help you guys focus on targeting your message and your outreach to specific block groups, rather than a spray and pray approach for orthopedics or just a zip code approach or a county approach. Oftentimes we see hospitals just, send out a message, hey, we want to increase orthopedics. Great, let's go put up 5 billboards with our top 5 orthopedics and be done with it. In this case, we really want to get more exact with how you guys target that message and to whom you target that message. And so to perform micro-target marketing, while it is a proprietary report that we do, I've added a few slides in here to really explain how we do it, so that in hopes that you could potentially do it on your own if you so desire. So the first section is we're going to look at the total market volume by zip code. So that's going to be a lot of what we just saw in the product line deep dive. That's going to be primarily ACA data to help us understand, once again, where that volume is. The next step is we're going to actually geocode, once again, your patient data and start to look at your patient data at a block group level. Then we're going to do some calculations to help you find which block groups have the right payer mix, have the right volume, and make sure that we're not marketing to areas that would cannibalize or double dip, so to speak, on our volume, but bring new good volume into the hospital. We're going to do that based off utilization rates. And at the end of the day, we want to come up with 5 block groups to help you guys understand where are the best places to target your message to, once again, grow that orthopedic product line. So once again, here we are in Winter Haven, Florida. The primary service area is the blue, once again, and the secondary service area is the green. Lakeland and Heart of Florida are our 2 biggest competitors, though Lake Wales comes in at number 3. Our hospital is here in the middle. Now at Stratasan, when we produce this report, the first thing that we always do is give away the answer key. This would have been great to have in college. I know Sean really needed it back in college. But what we want to do is give away the first, on this first slide, where we suggest you guys target specific outreach, whether it be marketing or physician relations. And so these are going to be these 5 block groups A, B, C, D, and E. I'm going to focus mostly on block group C, since I know you guys don't have all day with me. So we're going to really pick on block group C, because it is in our backyard, and also heart of Florida is really starting to take volume from us there as well. So the first thing I want to understand in this beginning is going to be a little bit of rehashing from the previous, but is really understanding from the total discharges from each zip code, how many discharges we had from each zip code, what is our market share at each zip code, and then what is our lost discharges at each zip code. Now, with some hospitals, you guys already know what your contribution margin is for an orthopedics patient, or you at least have a decent average. And in this case, we'd also want to add in potential contribution margin to show you guys how much more contribution margin and or revenue you could be achieving should you not lose a decent portion of those patients. Next thing we're going to do is look at drive times. Obviously, drive times are very important as healthcare goes. A and B are right outside of our 15-minute drive time. So the blue is 15 minutes, the yellow is 10 minutes, and the red is 5 minutes. And so they're right outside of our 15-minute, but there's real opportunity up here with A and B. Even though Lakeland is a strong leader, we still are going to try to attract patients from there with a specific message to go on the offense, so to speak. We also have D and E, that's a little bit more defense, and sadly C right now has to be offense because we're losing patients from there. Now what we're going to do is show you guys how we got to these 5 block groups while focusing mostly on block group C. And that is going to align directly with your marketing message to, say, block group C. But then we will also bring in the other wing, the physician relations, towards the end to show you how we can target block group C as well. So the orthopedics market analysis, this is going to be stuff that you just saw. The idea behind this is this would be the report you give your marketing team. So the product line deep dive is a strategic planning report. This is a marketing report and a physician relations report. So you're going to take some of the higher level detail that you have from the product line deep dive to parse out to them as well. So let them know where the cases are, where our competitors' cases are, where we are getting patients from, and so forth. We're also going to want to show market share just so our marketing team and physician relations understand, once again, very important, who's winning each zip code. We can look, and really, understand that throughout. And, as you can see, this zip code right next to us is, that we're in, heart of Florida is the predominant player other than us in the blue. We also want to show market dominance. We're trying to inform the folks that are going to execute our plan in what's happening in this market, as well as looking at those different discharges again and payer mix as well. This is another way to present the payer mix also. And now we're going to jump once again back into your volume by census tract, really looking at your internal your internal data. So now we've jumped a little bit closer into looking at orthopedics discharges. This is going to focus definitely more on the areas we're looking at. And you can see that we have some nice discharges in these block groups up here, and we do have some nice discharges in D&E. Just because we have a lot of volume doesn't mean we're getting, the amount of volume that we need. But once again, this is data that we have and only we have. This is our internal data. So, we can map this down to the block group level to look at the different types of people that are coming to us. The person that lives in this block group is different than the person that lives in this block group. Similarly, the people that live here are different than the folks that live here and here. And so we want to help you guys throughout, as we get towards the end of this, target those specific patients. So the next thing we're going to do for you guys is really estimate the total market by census tract or block group, in this case, census tract. So what you see on the screen now is how we are estimating the actual block group volume. And so what we've done here are applying a utilization rate, taking the ACA zip code level data, which for the most part, most of you guys have zip code level data. If you only have Medicare data, we would take that county level data and then do a probably census tract approach in that situation. We don't want to get too granular and project out too far. But in this case, we took the ages and ranges for males and females and applied a utilization rate. And then we took demographic data from Esri. As we mentioned, we use Esri. You could also use Prism or Maptitude or any of those other platforms for that, whoever your demographics provider is. And we applied this utilization rate that we then extrapolated and applied to our block groups to achieve the ultimate estimated discharges by block group over here on the right. And so now we've actually mapped that out. And we can see at a block group level, rather than a zip code level, this is not our data. This is overall market utilization, a block group level utilization. Now, the importance behind this is if you looked at this zip code right here, you can see that we've got in block group C some heavy utilization. Outside of block group C, there's some nice utilization as well. But within the same zip code, which is what ACA level data is available at, there are also block groups that are not heavy utilizers in orthopedics. So in a normal situation, you would have targeted this entire zip code because we knew we were down on this entire zip code. But when we're able to look at our internal data and then extrapolate and apply projections to the block group, we're able to focus on specific block groups within a zip code and focus that message on that specific block group. So rather than spraying and praying this entire zip code, which is still pretty direct, we're actually able to go directly after block group C, which is a specific type of person, and we're able to hit them with 5 to 10 messages, 5 to 10 more times, rather than if we had gone after the entire zip code and brought in volume that doesn't necessarily exist. Now, we're also going to be able, since we have your internal data at the block group level, at the rooftop level, really, we're going to be able to see where you guys are not getting patients. And so in this case, we're going to find where we're not getting patients. And so you can see A, B, C, D, and E, we're starting to lose patients. And then we're also going to be able to look at that market share. The way we did that is we know how many you have at the block group level, divide that over how many we project at the block group level. So we can see our market share is stronger down here. So that's more defensive. It's getting weaker here. So that's more offensive. And it's pretty weak up here. So that's definitely going on the offense. And so that's when you can instruct your marketing team, hey, we need to be aggressive here and play defense down here. Finally, and definitely quite important, is we're able to extrapolate the commercial orthopedic discharges by block group. Obviously, when you guys invest money in driving volume to your hospital, typically speaking, hospitals are looking to drive commercial volume, and that allows you guys to take care of all the patients in your service area so that you can actually make some contribution margin. So as we get through here, once again, we're going to give you guys summaries. And in an instance of time, I want to focus on block group C. So we've jumped ahead to block group C. And you guys can see we have an estimated orthopedics volume of 47. We have Winter Haven has 20. So we're at 42% market share. We have 27 cases that we could get. That potential revenue is going to be $556,000 in that one block group. We know the population, and we know the employees and the tapestry segmentation, which we will get into here in a second. One thing that's very important to note on block groups is going to be that block groups have their own specific unique identifying number. Very similar to zip codes. We are currently in 37201 here in Nashville. Each block group throughout the country has this very long zip code, unique identifying number. So if you were to go to your mail house when it's time for execution, or even to a certain extent with Google or Facebook, you're going to be able to get quite granular about how you target that message. And with the tapestry segments, when we talk about psychographics here in a second, we're going to be able to control what that message is. So towards the end of this report, and before we jump into the execution on the physician relations side, we are going to let you guys see what are the demographics, population, annual growth rate, median age, household income, and then the tapestry segmentation by block group here at the end. Now, our guys here in block group C are a 5D, which is part of Gen X Urban. Everybody thinks of Gen X Urban as being young, hip, and cool. Well, sadly, Gen X Urban these days is starting to need to get knee scopes and in some cases hip replacements. Don't tell that to our fearless CEO who's on the cusp of Gen X. However, what we're able to do with this and each of these different segmentations is there is a 15-page slide deck that goes along with each of the different tapestry segmentations within here that allows your marketing team to understand who these people are so that you can target them on the TV stations that they watch, on the websites that they look at. It lets you know if they have a mortgage, if they own 2 homes, did they go to college, how many families, how do these people communicate, how do they interact with society as a whole, where do they shop, and how do they shop. And so there are whole slide decks to accompany, and we can do a whole webinar on one of these segments alone to really help fuel your marketing team. Finally, in looking at that, one of the things we did want to boil down on some of that data is going to be, what these people are like, so the who in this case. And so in block group C, they're Home Depot shoppers. So you can see that they do DIY, or they're also remodeling or redoing their house. They also have 403B retirement plans, and they own personal finance software. Beyond that, we also know what kind of TV they're watching, what kind of radio they're listening to, things like that, so that you guys can specifically target your message to them. So now that we understand that we're losing patients, where we're losing patients, and at the end of the day, we have really 5 block groups to go after, it's now important, and we've really informed our marketing team. These are the types of people. This is the type of message. This is the way to communicate with them. Now it's important to bring in the other wing of the airplane, so to speak, or spaceship, and that's going to be physician relations. So in this case, this is where we use our physician relations platform known as Physician Pathway. And in that case, I'm going to hand it over to Sean as we look at our physician relations platform known as Pathways.
Thank you, Drake. I appreciate that. And again, thank you guys for joining us today. As Drake said, as a strategic plan and as that rocket ship portrayed, we want to look at orthopedics. We want to look at orthopedics and strategic growth associated with that service line. Now that we went through the micro-target marketing report, from the marketing standpoint, we know exactly which block groups, what are the pertinent populations for us to target from a marketing perspective. Now we want to look at referral patterns. We want to incorporate the physician relations department in this strategic plan to figure out ways to increase volume and increase referrals back to Winter Haven from an orthopedic standpoint. And how we're going to use that is our physician pathway tool here at Stratasan. This is the landing page for the platform. And what I'm going to do for today is not only look at internal physicians at Winter Haven to find referral patterns and growth opportunities. I really want to highlight growth opportunities from a competitive standpoint, looking at competing physicians at the surrounding facilities surrounding Winter Haven. And how I'm going to do that is use the find physician approach. And I want to look at Lakeland, Florida. Sorry, give me 1 second. Make sure this is full screen for you guys. Sorry about that. And I want to look at all orthopedic physicians in the Lakeland market. So over here on our right is a dynamic map that shows the locations of orthopedic physicians in the Lincoln market. And over here on our left is where we can filter down and choose specific physicians we'd like to analyze. So for today and for this particular webinar, I want to look at Heart of Florida Regional Medical Center. I want to look at what those orthopedic physicians are doing from a service line perspective, where they're producing revenue at which facilities. And then also I want to highlight referral patterns. I want to get granular and I want to figure out what primary care physicians in the market, what independent physicians are sending orthopedic patients to Heart of Florida Regional Medical Center instead of Winter Haven. And then on the flip side, I want to look at referral patterns outbound and figure out ways to build relationships and turn referrals back to Winter Haven. So I'm going to choose Dr. Samuel and Dr. Paul from Heart of Florida Regional Medical Center to analyze and run a report and figure out referral patterns from Heart of Florida's perspective. And for the sake of time, I'm going to go ahead and pull this report already up, already run. So here is the 2 physicians from Heart of Florida Regional Medical Center. This is the overview report. We actually have the amount of referrals that are being referred into Dr. Dowdy at Heart of Florida, the amount of referrals he is referring out, his average payment for his hospital cases, and his average payment for his office visits. Now, the first report we want to look at is the service lines report. This is taking a deep dive from an inpatient view and an outpatient view on what different service lines these guys are being associated with. So from an inpatient perspective, it's 100% orthopedic, which makes sense. And now when we switch it to outpatient, we can see Dr. Dowdy is producing 11% of neurology, and Dr. Samuel is doing some general medicine and some cardiology and so on and so forth. Now we want to look at the hospital's report. We want to look and see what facilities these guys are actually producing revenue in, what clinics, what hospitals, and things like that. And we can look at it from a service line view or a physician view. I'm going to go ahead and switch it to physician and see where these guys are actually producing revenue. Obviously, we can see that Dr. Samuel and Dr. Paul are producing the lion's share at Heart of Florida Regional Medical Center. Those guys are employed physicians of that particular facility, so that makes sense. But now we can see Dr. Samuel is producing a little under $200,000 at Cora Rehabilitation Clinics. Dr. Dowdy is producing $54,000 at South Lake Hospital. So from an internal perspective, if I ran a report on Winter Haven physicians, now I can see where exactly my internal physicians are producing work. Now, this is from a Heart of Florida hospital perspective, but as you can see, looking at this report, if you ran it on your, say, internal cardiologist or internal primary care physicians, you can see exactly which facilities are billing Medicare associated with your physicians. Now, for the most important part, and what I really want to get into here in just a few minutes, is the referrals report. Inside Physician Pathway, we actually have outbound and inbound referral patterns associated with the physicians we'd like to analyze. So now we're looking at 2 orthopedic physicians at my competing facility at the Heart of Florida Regional Medical Center. So from an inbound perspective, I want to see which primary care providers in the market are sending patients to those 2 orthopedic physicians. So I'm going to leave it at inbound, and I'm going to click see details for primary care providers in the market. So I'm going to highlight this Dr. Samuel for today. We can see Dr. Samuel is receiving patients from several different facilities. We're highlighting, Bartow Regional Medical Center. Dr. Shaw is sending 38 patients to Dr. Samuel. We can see, he's getting patients from Florida Hospital Heartland, which is an Adventist hospital, and Bartow is actually part of Baycare. So he is receiving patients from competing facilities. Why is that? What's going on from that perspective? And that's the first report, I really want to look at. And also Dr. Clement from Lake Wales, which is just to the south, as Drake highlighted earlier, he's also receiving patients from that particular primary care physician. And that's where I really want to look and see. I want to run a report on these 3 physicians highlighted here and see where some potential growth opportunities lie. As you can see, they're not affiliated or they're not associated with Heart of Florida. They're just choosing to send patients to Dr. Samuel. Why are they not sending to, the Winter Haven? Why are they not sending to, some internal orthopedic physicians at Winter Haven? So I'm going to back out, and I'm going to have this report already run and have those primary care physicians sending from Florida Hospital, Heartland, from Lake Wales, and all at different, practices in the market. One from Bartow. Let's see referral patterns and see outbound where else they're sending their orthopedic patients. So I'm going to jump right into the referrals report. I'm going to choose outbound. I'm going to scroll down here and choose orthopedic surgeons and see from an outbound perspective what physicians these guys are sending their patients to. So now, from a Winter Haven perspective, Dr. Clement is sending 32 patients to Dr. Morin at Winter Haven, which is great. And also, that's the only one on here from Winter Haven out of these, primary care physicians. So there's definitely room for opportunity. So we'll take Dr. Stephen here, for instance. Dr. Stephen is at Florida Hospital, I believe. He's at Florida Hospital Heartland, which is a Adventist facility. He is sending patients to, obviously a orthopedic physician at Florida Hospital, but he's also sending to Highlands Regional. He's also sending to Heart of Florida. Why is he sending to other places outside of his network? Let's go have a conversation with him and figure out, a way for him to send patients to Winter Haven. Why not? We have great facilities. We have great physicians. You're sending out of network now. Why is that? Let's figure out a way to turn those referrals to Winter Haven. And also, we'll highlight Dr. Shah here. Dr. Shah is at Bartow. That is a Baycare health system facility. He is sending out of network to Heart of Florida. Why is he sending there? We have perfectly good physicians and orthopedic physicians at Winter Haven. Let's figure out a way and set a meeting with Dr. Shah to figure out why he's sending to that facility. Let's get him to send to Winter Haven. And that's the job of that physician liaison, that director of marketing who is out in the market building relationships and things like that. So again, we're going to go back to that original report. I want to highlight one other thing for today. So that original report, let's see all primary care providers who are sending orthopedic patients to the 2 orthopedic physicians at Heart of Florida Regional Medical Center. The alarming thing we're seeing here is that there are several primary care physicians from Winter Haven who are sending out of network to the 2 physicians at Heart of Florida. From an internal perspective, that's an issue. We need to have a conversation with these 6, primary care physicians at Winter Haven. Why are you guys sending out of network? Is it facilities? Is it scheduling? What is going on? And I'm going to go ahead and run a report on those 6 physicians too. So here are those 6 physicians at Winter Haven Hospital, those primary care physicians we just saw, and we can see they're very close to that block group C that Drake was referring to earlier. Let's look and see from an outbound referral perspective where they're sending their orthopedic patients. Scroll down here. Now we can see, Dr. Gassner, Dr. Keown is sending to Dr. Sullivan at Winter Haven. But when we look at the data further, we can see that both of those physicians are sending, one is sending to South Florida Baptist Hospital to Dr. Goldsmith. He's also sending to Heart of Florida, and so on and so forth. All 5 of these primary care physicians are sending out of network. That is something from an internal perspective. There's got to be somebody on the team at Winter Haven to be able to have this conversation with these primary care physicians. The data doesn't lie. These are actual shared patients between physician A and physician B. So, looking at this data, that physician liaison is armed with that objective intelligence to go and build that relationship, not only externally with, independent physicians or competing physicians in the markets, but even more so internally. This is the low-hanging fruit. We got to figure out internally why orthopedic patients are leaving our physicians and leaving our facilities. Is it scheduling? Are they mad at our orthopedics department? Whatever it may be, we're now armed with that objective intelligence to know that there are patients leaving from these primary care physicians.
So that's a case in point of how, in this case, Sean is the physician liaison. I'm the strategic planner in charge of this product line. And I've unleashed him to go after, in this case, as he showed, finding relationships in block group C so that we're able to drive that strategic growth, really find those 116 patients that we need to get that 5% boost. That's our goal. And now, one of the key pieces here, obviously, as we look at this presentation, is really understanding the monitoring of the plan. So how are you guys in strategic planning going to monitor the plan? In a lot of cases, we see a lot of hospitals will just say, hey, we need to go after orthopedics. Let's go after this service area. Great. Well, even if you say, hey, let's go after these specific block groups and let's align marketing, let's align physician relations so that we're all, flying this the ship in the same direction. Beyond that, though, we need to track in a real-time basis to make sure we're doing what we need to do. And so that's when strategic planning and how strategic planning stays a part of this entire process. It's not just, it's literally flying the ship. And so in that case, we come back in and use your internal data to actually track where your patients are coming from in a real-time basis. And we will show you that here as we go through really quickly with our tracking piece. So once again, A, B, C, D, and E, focusing on C, our foci, I should say. Discharges since the campaign start date. So let's start to see where the discharge is coming from. We've done well in C. And And then we're going to start to break out so that you guys can prove, and this is all from your internal data, comparing year over year and quarter over quarter, so that you guys can prove to your C-suite that it's either going well or that it may not be going well. And so as we go through and look, we're going to look at the combined service area. We're also going to look at these target blocks. And really, when we start to look at, let's look at, in this case, compared to the same period in the prior year. So, Florida has a heavy, snowbird population. So in that case, we're going to want to look, how does this Q1 compare to Q1 of last year, or Q4, or so forth. And so we can see we are increasing in C. We're not increasing in A or E as well as we would like to. And so that's a challenge. So when we look at it, breaking this out, previous year to current year, Block Group C, we're crushing it. Sean has gone out and talked with those 5 physicians. We're making some real headway. Our marketing team has gone out and they have targeted that area with the right message. They're Gen Xers. But now we can see that we don't have very good increases in A or E. The question for you as a strategic planner then becomes, do we continue to invest in A and E, or do we double down on Block Group C, or maybe B or D, because we're having a little bit incrementally better job there and the contribution margin may be better. So what this allows you guys to do through a tracking report is really understand, A, what are we spending on the campaign and deploying our team, but B, how is it going in real time? Do we need to adjust? Do we need to change where our resources are headed? And so with that, and we're also going to look at it compared to the previous 2 quarters, so it's more of a real time as well. And that is our tracking piece as well. So, with that, we really wanted to give you guys, a way to align your entire team and really, go for strategic growth. Let's focus on a product line. Let's get marketing. Let's get physician relations all on the same team and flying the ship in the right direction. We do have a few minutes left. There are some question options. I know that a few people I will respond to individually. Andy Collignon asked, what mapping platform do we use? We use Esri for that. We could have used Tableau, Maptitude, or one other that I gave as well. And if you guys have any other questions, you can either shoot them to me now in the questions portal, or you can shoot us an email. My email is drake@stratasan.com, and Sean is sean@stratasan.com. But finally, we do have one poll before we go, and it is a how did we do today? And so we'd love to get your vote on how we did today. It's either great, good, badly, or terribly. And so we'd love to get your opinion on how we did today. And I will know how many of our coworkers are watching this by how many terribly I get.
Yes, please.
All right. Looks like nobody's saying we did poorly. That's fantastic. Well, as on behalf of Sean and Team Stratasan, the Stratanauts here in Nashville, we do really appreciate your spending time with us today. I'm glad nobody was watching Netflix instead of listening to us. And we hope you have a great day and hope we can help you guys any way down the line. Thank you very much.